My God, was this a humbling experience filming this episode? Wow. Okay, I thought I knew maybe just like an ounce of information about midwifery. To be honest, I thought it was midwifery. So already off the bat, I mean, but Ray was, you guessed it, a ray of sunshine. In that they were so informative into this world that is so profoundly misunderstood. I mean, me humbly being one of those people, and just how incredible the work is that they do. I mean, it's truly wild. I feel like I'm still processing all of this information, but you know, if you are planning to have children, if you're not planning to have children, I think this is just important information to have in your back pocket. So come with an open mind, come with an open heart, go empty your vacuum canister, and welcome to Open Wide. Hi.
Hi there.
How are we feeling in this exact moment right now?
A little squirrely, but good.
Yeah. We love squirrely.
Yeah.
You look fabulous.
Thank you.
You also just have the most like safe, beautiful aura about you. I don't know why I feel like I'm like an ayahuasca shaman, but that is like, I can feel it.
I appreciate that.
Yeah.
As you know, it's been a work in the making.
Sure.
It's kind of like the midwife foundation there.
Is to have good vibes.
Yeah.
Okay. I feel them. Mm-hmm. Well, I have a litany of questions to ask you because I'm sure I am so just uninformed about this incredible job that you do. And I want to know quite literally everything. Mm-hmm. But I also want to know, do you know when you were brought into this world, was there a midwife present?
Oh, for me personally?
Mm-hmm.
You know what? I think that there was.
Okay.
So there's like, I mean, short answer, yes. Long answer, there's like lots of different types of midwives.
Okay.
But I was born in a hospital and like just thankfully had a really amazing group practice there that was like is really well known in my hometown. I'm from New York, and so like across the river, across the Hudson River, there is Rhinebeck, and they have just like they've had this really progressive like birthing suite option for families. So I was baby number 4, and by that point my mom had like kind of been through it, like known what was good and found like a good care option. And I believe that like they did utilize nurse midwives at that practice.
Oh, whoa.
Yeah.
But it was still pretty new.
Yeah. No.
Ish? Not?
No.
Okay.
It's like been like pretty well established. But I think she had just kind of like gone like a few different routes before that, and like
oh, you were baby number 4 in your family?
Yeah.
Oh, got it. Okay.
Yeah.
Okay.
So she kind of felt out some doctors, and then she found a place that she really liked, and and I think that they do use midwives there. So
wow.
Yeah.
Okay. And what is the difference between a midwife and a doula?
Yeah. So great question. It's a really common one, and the best way that I can explain it, and it's helpful to remember, like midwife medical. So doulas are like amazing. I love working with doulas, and they're providing like physical, emotional, informational support for families.
Okay.
But more in that, like if you think of like the birth coach kind of archetype, like that's more their job is like non-medical. And then whereas midwife, like I am a healthcare provider. So my primary job is like monitoring the health of families and making sure that their home birth is safe by like checking on the parents and the baby.
So is the idea that a doula could be at a home birth, hospital birth, but generally a midwife is associated with a home birth?
It's very complicated.
Okay.
So I think there's an association there with like midwives and doulas, because a lot of times we do share that foundation of like client-centered care. And a lot of times, like, doulas are also, like, midwives, our expertise is, like, normal physiological birth. So, birth in, like, uninterrupted by interventions, like if left alone in like normal circumstances, what that would look like. And doulas share a lot of that like same approach and like expertise in normal birth and like ways to kind of cope with pain and give direction to like help that progress. But yeah, I think there's just like a lot of misunderstandings about like what a midwife is then, because it's like, you know, kind of that shared philosophy of like having a family-centered, client-centered approach versus like the medical model of care, which is to, you know, kind of like in the United States, a for-profit healthcare system that like, you know, cranks people in and out, and healthcare just kind of happens to you versus like with you.
Oh. But in both scenarios with a doula and a midwife, the Western approach can coexist with your approach too?
Yeah. So where it gets like kind of niche here is that, so the type of midwife that I am, which I'm a licensed midwife, is like in the state of California, you know, we're licensed, regulated by the medical board. So like we have like a different certification process than like say a nurse midwife. And while like there are some nurse midwives that practice in a home setting, and there's some doctors too, like they're pretty rare, but like want to do home birth with families, where I am not working in a hospital. So, and licensed midwives in general, like they're not working in a hospital. Sure. Whereas like nurse midwives could potentially do both.
So then if a client came to you and said, I want to have a hospital birth, but I would love to enlist your services, would that create a conflict of interest?
I would be like, okay, well, let's talk about that.
Sure, let's unpack.
You know, because, but I do offer that services for like limited families. And all right, we're getting crazy here. There's something called a monitrice.
Ooh.
Yeah.
Love
Third
that.
vocab word to just continue to confuse everyone.
A monitrice?
A monitrice is basically like a doula on steroids. And because of my licensing and because of my training, for families that are planning a hospital birth, if they did want, like for whatever reason, and usually that reason boils down to like something came up, like because we're only doing low risk pregnancy and birth. So if somebody has a health complication come up or is like aware of that going into their pregnancy and isn't eligible to have a home birth with a midwife, then maybe they would reach out and say, hey, like I have to have a I have to have a hospital birth, but I want the care of you know, home birth midwifery. Then I've been in situations where I like you know, first of all just did like co-care for people that planned a hospital birth and still wanted like the excellent prenatal care that we offer, or the monitrice services, which is basically like we're planning to do a hospital birth, but you only want to be there to like literally show up, push your baby out, and like minimize the time that we spend there. And so like as you know, as a midwife, I am able to do like limited skills for like, you know, for certain situations where I could potentially offer like vaginal exams to tell you like, okay, it's time, you know, and basically to help you judge when is it appropriate to go into the hospital.
So you can see, you know, dilation size.
Correct.
And you're like, we could be at home as long as we can. And then you can decide, all right, it's showtime. We can take you.
Yeah, because it can be kind of hard to judge. So like for families that are just like really like wanting to stay home as long as possible. And then I like would go with them and basically just take on that like labor support non-medical role in the hospital.
That's so wild.
Yeah.
Okay. We're going to get into that a little later, but I'm curious, what did your training look like? Because it does sound medical in ways.
Yeah.
So what did that look like?
Yeah, so I mean, I'm a medical provider, and the job that I'm doing is like the same standard prenatal care that you would get at an OB's office. So we're seeing people for prenatal visits. We are doing lab work. We are sending people for ultrasounds. Like, we're doing all that stuff. Like,
Even pre-pregnancy.
yeah. So we have like, like the 9 months of prenatal care to like build rapport and like get to know our families and stuff. And then also like really be vigilantly monitoring their health during that time. So like by the time that we get to the point where someone is having a home birth, like we've already established that they are low risk, meaning that they don't have like additional health complications in addition to being pregnant
from all of these tests that they had done with you prior to.
And we have certain criteria that we're working with, like the state of California has kind of outlined, here's what it means to be low risk in pregnancy. And so they give us examples and they say like, this is cool, this isn't, like this is, this is a reason to have a consultation, this is a reason to go in for an evaluation and get cleared or whatever, and this is like a hard line, like you got to transfer care.
Okay. And is there literally midwifery school? Is this, so is it something post college? Can you go after high school? Like when?
Yeah.
Okay.
Yeah, you get ready.
Okay.
Strap in.
I'm so excited.
Okay. So we've covered, there's like several different types of midwives in the United States. And also, just disclaimer, the United States is weird and we're doing everything like very backwards. And it turns out our healthcare system isn't great. And where that shows up the most, is like our pregnancy outcomes and our newborn outcomes for families.
Also, went to the OB yesterday and I found out that now insurance is now only covering a pap smear every 3 to 5 years. Like to test for HPV is $200 out of pocket now.
I got charged $600 one time.
What are we talking about?
Because my pap like reflexed.
Yeah.
And so, I got a $600 bill for a pap smear. I was like,
I just feel like we are going backwards.
Yeah. So I think it's like hard for people to wrap their head around like the idea of midwifery care. But I'm like, okay, so like, how's your experience getting health care so far?
Sure.
Because this is a time, pregnancy is a time where like there's obviously like, and my approach is that like pregnancy is like a combination of a medical experience. Yes, there's this element to it, but there's also this just like social and developmental life stage aspect to it. And so that's kind of like our philosophy, is that like, that idea of what does like normal physiological birth look like and pregnancy. And when we break it down, kind of like historically how things have been done for thousands of years, has been to do home birth with midwives, and before like the American Medical Association decided like this is the best and cleanest place to have a baby.
Sure.
Like this is how we did it, in the United States too.
Is there this argument that was the case, but the risk was higher back then?
Say more.
Like, if it was the case where home births were the norm, wasn't there also kind of this coinciding idea that babies wouldn't make it as much back then? Again, I don't know.
Yeah, no. Honestly, I'm glad that you asked, because I feel like a lot of people have these ideas, and the short answer is I'm really glad that we have some of these interventions. I'm not anti-hospital. I'm not like anti-healthcare. But there is like a degree, and I should say that midwifery is still the standard of care around the world.
Totally.
This is still like, this is like again, the United States is the outlier. But in developed, high resource nations where like maternal outcomes are way better than what we have, for like being, an incredibly resource rich country, like we have terrible health outcomes, like some of the worst. But like when you look at kind of like many different places in Europe and like pretty much everywhere else in the world, they're using midwives and they're offering home birth as a standard option. So it is still the standard of care, and the United States is the one that's like not up to date there.
Right. It kind of reminds me, I'm so sorry to make this comparison, but I feel like in the Western world, a lot of people find acupuncture to be this woo-woo crazy thing, but in the Eastern world, it's the most commonly used form of healthcare. So it's like wherever you are, you could just have this misconception of a form of healthcare that may be so easily accessible, revered in other parts of the world, you know?
And incredibly evidence-based.
Totally.
Same as midwifery care. Like,
Totally.
acupuncture is one of the most well-researched, like, quote-unquote, alternative medicines.
Yeah.
And we have, like mountains of evidence. And same for midwifery care. We have mountains of evidence that this is, like, a really cost-effective and, like, great way to improve outcomes for families.
Yeah.
To
Yeah,
reduce their risk of, like, preeclampsia. And to, improve the health of moms and parents and babies. But to go back to what you were saying, you were like, oh, is it back in the day, was it more dangerous? And that's why we invented hospitals. I know, I like when you were like, oh, don't worry, like we're not going to get too into the politics before we were like talking before the section. Strap in again.
Okay.
Because basically, I mean, the root of it was like medical racism. So like hospitals have been popularized for like less than 100 years. Like basically in the early 1900s, they first kind of came about. And in order to like have greater control over families, basically the institution of healthcare kind of like took over, which was like white male doctors, and started to like just be like literal smear campaigns, you know, to say like, oh, those midwives that are doing home birth, you know, they're dirty, they're uneducated, you know, and who was it? Was like predominantly the like granny midwives, the black midwives in, you know, in the South or in rural areas or like most of the United States. That was like they were overseeing the majority of births going on for like black families and for white families. But yeah, the American Medical Association and just like, you know, kind of the institution of healthcare like cracked down on those midwives and was like, no, like what you're doing is unsafe. And like we have this like modern, you know, thing that we can offer now. And this is like what you're doing is like backwards, you know.
I mean, what a slap to the face.
Yeah. So, and you had asked, well, was it more like dangerous back then? And again, like there are appropriate reasons for someone to have a hospital birth. So if you have things like other health complications in addition to pregnancy, you know, then your risk of having a complication during your birth, you know, it significantly increases, right? So like, for example, like if you have a history of diabetes before pregnancy, like that's like a really, you know, a really significant thing that impacts your health. So like, in those instances, like having access to a surgeon, you know, is a good thing. Having access to like a higher level of care is a good thing. But we've kind of like, you know, the pendulum has kind of swung to the point where like it's like, yeah, it's great that we have these interventions,
but it doesn't necessarily have to be the norm,
right? And are we like using them because there's an actual problem, or are we using them for the convenience of your healthcare provider? Yeah. And so like if you're looking at what is the standard today for a hospital birth, they just don't see unmedicated birth, which is like, our specialty is we're not doing like epidural pain management. Right. We're not inducing labor. We're not giving people medication to like make their contractions stronger. But in the hospital, like pretty much everyone is getting these medications. Right. Right. And what it comes down to is that unmedicated birth, like physiological birth, is just not profitable. Because most of my job is sitting around and waiting for someone to have their baby. For your first baby, like on average, for a first-time parent, for normal, like nothing wrong with that, is 24 hours.
Whoa.
Yeah.
So you could be there for the full 24 hours?
Absolutely, yeah. And that's still like normal.
Right.
And we try to time it so that we're not there the whole time. But sometimes we do. Sometimes we are.
Bring your lunch pail. You're like, I'm locking in. Yeah.
And sometimes it can be for days, you know, and that can still be like a variation of normal. And we're like assessing people's health throughout that. But like in a hospital setting, if the insurance says, hey, we'll cover 12 hours of your stay and after that you're getting nothing, the incentive is to like get you in, get you out, and like serve the next person.
It is such a wild concept that after you had arguably one of the most traumatic things happen to you, even though it's a beautiful thing, thing being birth, you then are like whisked out of the hospital and you're holding this new baby and you're like, whoa, okay, what happens now? Like there is this very detached sense that I'm gathering from hospital births. And again, it sounds so nuanced, and you're right. I feel like it's impossible to not get political with it somehow. But knowing that there are other options is empowering, right? Like knowing that your services are available so that it doesn't have to be this in, out, quick. I'm now shaking after an epidural. Like there's so many more things we can learn about this whole process.
Yeah.
Oh, that's so trippy.
Yeah. And
Okay.
like I said, like I'm not anti-hospital. I don't think that like everyone needs to have a home birth. Like I truly believe that you need to give birth where you feel the safest.
Sure.
But I think for a lot of people, they are starting to come around to the idea of like, I don't feel safe in a hospital. And like, and statistically, like I am not safe in a hospital, especially for like marginalized people, especially for Black and brown families. Like walking into a hospital full of racism, like your odds of like coming out of that experience, you know, like without having your health affected, it's not looking so good. Like right now in the United States, our rate of cesarean birth is 1 in 3.
Okay.
So that's
Yes.
yeah, 1 in 3 people walking in and getting major abdominal surgery. And there's some cases where like that's the right call, but there's many more cases where this is the result of the over management of birth and the impatience of providers and the convenience of your healthcare provider, and like giving people unnecessary medications that speed up your labor because it's like, okay, let's go. Like, let's, you know, I'm tired of waiting around for this.
Sure.
And then all of a sudden, like, oh, like, you know, you're having these super strong contractions. Now your baby is stressed out because you're having these abnormally strong contractions, you know? And then it's like, oh, well, all of a sudden baby's not sounding good. So like we're going to whisk you away to get surgery, or like, you know, I hate to say it, but surgery is a lot more profitable.
I was going to ask, are C-sections
than an unmedicated birth,
Okay.
you know?
Okay.
So there is significant financial incentive
There's some muddy waters.
to have. Yeah, exactly.
Okay.
Exactly. So, and that's why like we're seeing so many closures of labor and delivery units, especially in California. Like if you look into it, you know, a lot of when hospitals are like, you know, cutting down the budget, whatever, like maternity units are the first ones to go, because again, like birth is just not that profitable. And what we do, like the model of my job is extremely inefficient for costs, like from that perspective, you know, because it is like a lot of personal interaction with one healthcare provider. Like I am the one person that's in charge of like someone's prenatal care, birth, postpartum, newborn care. And so like that.
And you do newborn care as well. Okay.
Yeah.
Okay.
Yeah.
It really is full circle.
Yeah. And to give that like personal attentive care, like it just doesn't fit with the like, you know, cost savings model of healthcare, where you're like just trying to serve as many people as possible in like the shortest time possible.
So then if hospitals are on one side of the spectrum, at-home births on the other, are birthing centers somewhere in the middle?
Again, strap in.
Okay, okay.
So like there's different ideas, and I think a lot of like hospital birth suites or whatever kind of like market themselves as birth centers.
Okay.
But what that means, like what I think of as a freestanding birth center is like a like community-based, not associated with a hospital birth center that's like staffed and run by midwives.
Okay.
So, which I have experienced like my training and stuff I've worked in several different birth center practices, and it's essentially the same as a home birth. Like, you have the same...
These independent birthing centers.
Yeah,
Okay.
you have the same professionals, like, giving care. You have essentially the same equipment. And I think, like, there's lots of different reasons why people might choose a birth center versus, like, home birth. But for the most part, like, it's basically the same.
Got it.
That kind of birth center.
Got it. Okay. Holy shit.
I know.
Okay.
I'm like, what was our original question here?
I know. I'm getting schooling?
A little sidetracked. Okay. So I went to school.
Yeah. So you got a specific education for this.
Correct.
Was it 4 years, 2 years?
So I went to... there's a lot of different programs. Mine specifically, I got my master's degree in my master's of science in midwifery.
Okay.
That was a 3 to 5 year program. I did it in 4 years.
Okay.
And that is not. It was kind of a unique program. It's not super common, and there's really relatively kind of just a handful of midwifery schools in the U.S.
Okay.
For the type of midwife that I am, which is a direct entry midwife, basically meaning I didn't go to nursing school first before I decided to specialize in midwifery.
Got it. But you don't need that.
Correct.
Right.
Let me break it down for you.
Yeah, I'm locked in.
All
Tell
right.
me.
Okay. So every state in the United States, every state is pretty different as far as midwifery practice and what is required. So where you want to practice can ultimately affect what path that you take, which was sort of my case, because I was born and raised in New York, where they don't have the same there's a certification, but not the same as the one in California.
Okay.
In New York, I was studying and knew that I wanted to be a midwife, and saw that they one of the requirements is to have a master's degree. So to me, I was like, oh, well, I guess that makes sense. And I had just finished my bachelor's. So I was like, okay, well, here's this program that's a master's program. And that seems it's kind of what I'm looking for. And so that was, how I kind of made my decision. But there are other programs, and I'm really supportive of different paths to midwifery education too, because what I did is extremely inaccessible. Oh. And you don't even want to know about my student loan situation.
Really?
Yeah.
It's expensive.
Crazy for a profession where I am making not very much money.
Stop.
The amount of student loan debt that I have now is pretty crazy.
Perfect.
So yeah, it's awesome. I just put it away in my little box in my head that I just don't think about.
Yep.
Yeah.
So you did that for 4 years,
I
and
did.
then at that point, you're licensed, you're ready to go. You're building a clientele. I'm assuming it's kind of word of mouth. I mean, also your website and your marketing is beautiful.
Aw, thank
there's
you.
definitely,
Thank you
I
so
can tell you
much.
are established in this world.
Aw.
I'm curious if you felt because this is kind of a common thread that I get with people who go to specialized schools, whether that's trade schools or the like. The most experience or the most knowledge that they gather is from being, quote, in the field. Do you feel like that was the same for you? Once you were actually up and running, you're like, oh, okay.
Yeah.
This is it.
That's a good point. And I do think it is helpful to think about midwifery as sort of a trade. What I did was kind of that higher education path or whatever.
Sure.
But this is traditionally an apprenticeship model.
Oh.
So while my program was kind of unique in that it offered the master's program, not all do. Some there's a couple bachelors. There's a lot that are just certificate bearing, and all of them involve some method of apprenticeship. So during school, I was working as a student midwife and kind of going up in responsibility, depending on where I was at in my, in my studies.
Okay.
But then graduated as doing the primary skills, doing the hands-on learning. So
I think that's so amazing, because if you're an apprentice, it sounds like you are already gathering all of this information to be do I want to do this? Because you're already kind of thrown into the world that you're studying to become. because I think sometimes, like, I think with law students, I'm like, you did all of that work, and what if you graduate, you pass the bar, and then you're like, oh, I don't want to do this.
Yeah.
So that's awesome that you get to kind of get a glimpse into the world while you're still studying. And I'm assuming it kept you in it. Like, I'm assuming it still ignited your passion for it.
Yeah.
Okay.
For sure. And like there was definitely a point during like my education, because I just didn't know that much getting into it before I like chose this.
Yeah, what inspired you to even start?
I like a lot of different things, but my grandma was actually a labor and delivery nurse.
No way.
So I grew up like hearing her birth stories, and like, you know, she was like a really rad lady, and our family is like, she's like our matriarch. And so we just like always had a lot of respect for what she did. And, you know, we would hang out and go grocery shopping or whatever. And like someone would come up to us and be like, did you know that your grandmother
she was a legend
at my birth? And I'll be like, oh, okay. You know,
like, I'm just getting a smoothie.
Yeah,
Thank
but
you.
it was like, it was so cool. Yeah. So she was kind of Nanny Tony, the blueprint for me. Yeah.
First of all, fabulous name.
Yeah.
Obsessed.
She's great.
So, okay, so you graduated, you started building your clientele. I'm curious. So I know you can provide prenatal care, but let's say a couple comes to you, someone's pregnant, and they want to hire you for your services. What does that look like leading up to the birth, the day of the birth? Are you seeing them weekly, monthly? Is it phone calls? Like, what would that look like?
Yeah. So people are welcome to start like as soon as they want. I have a client right now that hit me up like as soon as she got a positive pregnancy test. So she was like 4 weeks pregnant. She was like, "Hi, it's me."
Yeah.
And yeah, so like it's great to be able to get started from the beginning, because our job very much is based on that like relationship in care. And so it's like a relationship building experience.
Okay.
Like having hour-long prenatal visits where we're like actually having that time to like talk, and you're not like waiting in the, you know, lobby for 3 hours. And so like getting started as early as possible is great. We follow the same routine schedule of visits as like, again, like a hospital OB model, which would be like seeing you basically monthly for that first, you know, early pregnancy trimester. And then like more often once you're later in pregnancy. So like then like every 2 weeks after like 26 weeks. And then once you're kind of like getting ready to pop, we'll start seeing you more often, like every week.
Okay.
Yeah.
And are you administering ultrasounds? Are you...
So I don't have, like, an ultrasound machine is large and expensive.
Sure.
So I just refer out for that. Like, I'll just, like, but I'm able to, like, send clients referrals. Yeah.
Okay.
For what they need. And then I am doing, like, my own lab work. Or, like, I have, like, a lab that I can send them to for a blood draw or whatever. But I'm typically, like, drawing labs and, like, ordering them.
So would it be uncommon for a client to have both an OB and a midwife? Would that kind of be overkill at that point?
I don't love that. Like, it definitely happens. And like, maybe there's certain situations like we were talking before about, you know, the monetary stuff, like where someone has to see an OB and has to have a hospital birth, whatever. But I don't love doing that, like shared care, because it is a toss-up whether the provider that you're going to is like following evidence-based practices. You're gonna find, and you know, and this is true for all settings, but I am gonna call out like hospital practices here for like just kind of doing stuff because some guy, you know, liked to do that you know, and that's just how the tradition of the hospital developed, you know, and so that's just what they do.
Sure.
So, like, specifically when we are, like, planning for a home birth, like, we have our own criteria that we are looking for. And, like, versus, like, a hospital, like, maybe they're not thinking, like, oh, well, like, you know, she's going to have a home birth. So like, you know, this is kind of fine, but also,
Sure.
you know, like they're operating from the place of like, okay, well, I have all these resources at my disposal here. So like, whatever, like Ryan sucks, fine. Like she'll survive, you know, versus like, we have to be a little bit more selective with people and like be more on it. Cause it's like, okay, well, at the end of the day, like it's me at your birth, you know, and I'm your primary healthcare provider, and I don't have like a team that I could just push a button and like 12 people show up and they have like, you know, they take over from there. It is like a big responsibility. And so I have to like make sure that people are safe going into it, and that and that by the time that we get to their birth, like we kind of like checked our boxes for like, okay, like, you know, we're just being preventative here.
Okay.
Yeah.
So you cross all the T's, dot
yeah,
all the I's.
but like heads will butt, you know, if you have like co-care going on, if you have two healthcare providers, we maybe don't see eye to eye. And like most midwives, you know, like me and my colleagues, we might not see the same thing exactly. There are hard deadlines and there are hard like criteria for like risks and stuff like that, but there is also a significant amount of gray area that is up to a provider's discretion. And so like if I've got like a client that I'm sending in and you know, they've like, for example, like all of their tests have come back normal, like they did like a screening test to make sure that they don't have diabetes, their baby's measuring normal, like but like they're fat. Then their provider is going to be like, well, we see that your lab work is fine, but did you know that you're also fat?
Perfect.
And so you and your baby are like gonna die.
Love it.
Yeah. So,
just what you want to hear.
Yeah.
Yeah.
Exactly. So it's just like not, and that's what I mean by not necessarily evidence-based, is like people just have their own bias or like they have like protocols that are not necessarily based in fact. And so like like it can get kind of dicey because if an OB says like, oh no, like you have this high risk factor, you know, whether or not that's objectively true, like they've said it. And so now I'm kind of like, okay, well that sucks because they just deemed you high risk, you know, even though that doesn't
have to follow suit.
Right. It can it's just
Okay.
can get dicey because it's like, okay, well they said that you should be induced, you know, and like because you're 35 years old, you know, and that policy is maybe based on like them not wanting to get sued, or like, oh, well, you know, just the lowest risk factor for us as the hospital is to like just induce everybody so that nobody has this rare like complication. Nobody has this.
Sure.
And like not leaving it up to clients themselves to like, you know, weigh that their own comfort with the risk.
Sure.
And
oh, that is so messy.
it gets so messy. And so that's why I hate co-care. Yeah.
Totally makes sense.
Yeah.
Okay.
And I'm working like with my own criteria and like, you know, have my own experience and you know, and I'm maybe consulting when it's appropriate when things come up, but I am really committed to like evidence-based practices and like making sure that the recommendations that we're making are like based in fact, and also like in like centering the clients. It means like having realistic informed consent conversations where I'm educating them about the risks and the benefits of certain decisions and leaving it to them, like with my own, you know, boundaries and comfort level in mind too, but like leaving it to them often to make the choice for themselves, what they feel is best for their families, what they feel comfortable with. Okay. You know, because it's not like there are risks associated with home birth. There are risks associated with hospital birth. Sure. You know, and so like the same prescription of care is not going to fit for everybody, but everybody should have the right to like make their own healthcare choices and decide what risk they are comfortable with. Yeah. You know? Yeah. So yeah, it is long story short, a little bit of overkill to have an OB and a midwife. Okay. Yeah. Okay. So I just see them like, I don't have like someone like supervising me. Like I'm the healthcare provider.
Got it.
Yeah. So I don't need like
so much
somebody.
pressure, but so rewarding at the same time.
Yeah.
Yeah. Okay. I just keep laughing in my head because you are so eloquent and so just knowledgeable. And the question that is coming to my mind is, are all home births in a tub? Are they all in water?
Not all of them, but a lot of them.
Okay.
Yeah.
Okay.
Yeah.
So some of them could just be a dry
land birth.
Sure.
Yes.
Okay.
We do some of those. And, you know, as a provider, I'm like, yay, I don't have to like stick my hand in this girl's tub. Perfect. But if it was me, like, you know, giving birth, I would want to be able to give birth in the water. That's like our number one, like comfort measure for people. Like a lot of people, once they get in the tub, it's hard to get them out because they are just like so much more comfortable.
I feel like it also takes some of the gravity off, and it's like a nice little.
Exactly. Okay. Yeah. So we do a lot of water births.
Okay, but it could be either.
Yeah. Do you have questions about that?
I'm sure, but I also have so many other questions that we'll probably have to do a part 2. Is midwifery covered by insurance?
Great question. I'm not able to contract directly with insurance companies because of the requirements that they have. They want me to like buy liability insurance, which in California is like $30,000 a year.
Perfect.
Which is awesome because I'm like,
add it to the debt.
I'm like, okay, well, I can't afford that.
Yep.
But luckily what I'm able to do is send clients to a medical biller who can bill basically for them. So they would still pay me directly for the services, but then get
like a
reimbursed.
Super bill, kind of?
Yeah, kind of. Like, you know, a spicy super bill with like actual, you know, like coding or whatever that goes into it. I try not to worry about myself about that because it's just really complicated.
Yeah. So in ways, yes, it can be.
Yeah. Okay. So you get like, you wouldn't, most setups are like, oh, you give people, you know, the insurance companies pay for things and then you pay the insurance companies later. So this is a little different where like they would pay me first and then get insurance reimbursement. So basically get money back for after the services.
Got it. Okay. Damn.
Yeah.
So then I'm curious, let's say you just wrapped up a 24-hour birth. How do you come down from that? You are now driving home. You have finished that time, which feels like not even the correct word to use. What are your kind of rituals to just like get back into your body? Or is that a time where you feel the most in your body?
Good question. I think I need to maybe work on that. I have like a good pre-birth ritual, but post-birth, I usually just rot for like at least a minimum 36 hours.
Sure. Just bye world.
Yeah. Like,
see ya.
Oh, God. I have like my comfort meal of like my low effort dinner of veggie nuggets and macaroni and cheese.
Hell yeah.
And now I have a girlfriend, so she takes pretty good care of me.
Bless her.
Yeah. Honestly, she's changed my life. But yeah, it's usually like just keeping it low key, especially if I've been super sleep deprived. Like I used to get really bad FOMO of like, I gotta go to bed, but it's like 3 p.m. and like everybody just got to have like a day, and now I'm going to bed because like
you've been up.
It gets really confusing.
Right.
I'm like, what's happening right now?
Sure.
But yeah, usually just like making a lazy day. I try not to do anything too intensive.
Okay.
Like I'm a roller skater, and like there's been a couple times where I like had plans to like skate, and then I'm like, well, I just got off a birth, so I'm basically like drunk and like shouldn't be like
on wheels.
Yeah, just shouldn't do that.
Feet on the ground. Yeah.
You know, try not to do anything too stressful. It's really hard on the body, so I usually just like post birth, I'm resting hardcore.
Okay.
Yeah.
Oh my gosh. Okay, so I want to try a segment with you. It's pretty new. It's called Open Wide, the name of my podcast.
Okay.
I'm going to name you a few things, and I just want you to give me like your quick little hot takes on them.
Okay.
They're going to be random little tidbits, and just whatever comes to your mind. Just tell me what comes up. Number 1, CVS receipts.
I steal my grandmother's, who died like 2 years ago, her CVS account phone number.
Yeah.
And for Walgreens too.
I feel like she would want that for you.
I think so too.
Okay, that's beautiful, actually.
That's all I can think of.
I love that. Underwear at the end of the day during ovulation.
Underwear at the end of the day during ovulation. Juicy?
Yeah, I mean, it's just like an absolute crime. It's crazy. Does the toilet paper roll go over or under?
I have literally never paid attention.
You're just tits
I'm just out
whatever.
Here.
Yeah. As long as it's on the roll, you're jazzed.
Not even.
It could be on the floor.
I'm like, whatever. I try to keep it off the floor.
Okay.
But I'm like, you know.
Just stoked to have toilet paper.
Yeah. I'm like, great. As long as we got it, works for me.
Blessed. The last time you uncontrollably sobbed from a movie or TV show?
10 Things I Hate About You. Heath Ledger, and he's got that, little musical number.
Just tears streaming
If I ever want to
down.
cry, I'll just like look up that video.
Isn't that crazy how like we all have those ones that we can just do a little quick YouTube search and it's just tears, Niagara Falls.
Yeah.
Damn. Well, you killed it.
Thank you.
It's a quick little yes, $1 million.
Great.
I want to know also, so how do you tailor your care and your education, everything you know about this world of midwifery to your clients, maybe like different cultural backgrounds, different political opinion. I mean, I don't even want to get into the politics, even though we already have. But how do you still tailor it towards everyone's kind of specific tastes, flavors, what have you, while still keeping your kind of integrity? And yeah.
I think there's like, in that respect, there's only so much I can do being a queer provider, like, and like, quote unquote, visibly queer or whatever that means. Like, people catch a vibe, the hateful ones, they always seem to catch a vibe. Something about it. So like, there's really only so much I can do to like water myself down in that respect. So I am like, I don't really strive for like a new, I think there's a lot of midwives for whatever reason, they're going for that like very neutral, bland effect. And that's just not me as a midwife, just because of like, that's not why I got into it. That's not who I am. And even if I tried, it just wouldn't work very well.
Sure. And nor should you. I mean, I think that also, it's a balance where you then attract the clientele that you want to work with as well. And it's because you are very intimately involved in these people's lives. And I wouldn't want you to water yourself down. Don't do it.
Yeah. And it is vulnerable, but I'm just trying to put myself out there authentically. And I think also just operating from that lens of like, and for a lot of people that just doesn't work. And for like, for a lot of marginalized people that approach doesn't work, of like trying to like appeal to all. So I just try to make like my space inclusive, and I'm pretty clear about my values so that you know what you're getting into. And I'm hoping that like the right people will find me, and also keeping like, even so, like keeping an understanding for like, people just have different life experience than me.
Sure.
People have different perspectives on things, so maybe we don't see eye to eye on like every aspect of care or whatever. But yeah, like really trying to like step away from things, and as a healthcare provider, I think it's really important to just be aware of like your own, be aware of your biases, and like when you have strong opinions about decision making in care, so that you can like be aware of that, and and really just like center your clients and what they need, and recognizing that some people's choices might be different than what you would make, and and recognizing like when that's a deal breaker, like, and when that's like not, so I try to be boundaried in my care, and like understanding myself well, and like what I'm comfortable with, but also like leaving that space to be like, okay, well, like I, if it was me personally, like I wouldn't do that, but it's not me, know, it's somebody else, and it's their family, and trying to take a step back and let them,
Do you ever get into like full-blown arguments like during the birth process where it's just like heightened, everyone's like, what's happening, whether it's misdirected or not? Do you ever get into like heated, just like emotional things during the birth process?
That's a really good question. I'm like scanning my brain. It doesn't really feel like that way. I think I also just try to keep like a lot of sensitivity for the fact that like people birth is basically like an altered state. The hormones, the pain that you're in, like you're just like, it's really hard to think clearly. So it's difficult to you can't, like, there's only so much informed consent that can happen there. So I try to have really good conversations with people beforehand.
Sure.
But have I ever wanted to slap someone's meemaw?
Right.
Yeah.
Who's mouthing off in the corner, and you're like, hey, babe.
Oh my God, this woman.
Oh no.
Well, what are we supposed to do if this is happening? And I'm just like,
You're like, hey, so I actually know what to do here. That may sound crazy, but I got this.
Yeah. I'm like, why did you invite this woman?
Mima. Have a seat.
That's probably like the hardest thing. And if, you know, again, it's someone's family member and they're seeing like someone and maybe they're not that down with home birth or whatever. And I'm like, in that case, well, why did you invite them? You know,
seems like an
they're just
interesting
going to be
decision.
like freaking out in the corner about it. You know, I think you should only invite people to your home birth that are going to be able to hold space for you to freak out.
Sure.
You know? Because that's like
in
your
your
right.
home. That's like a memory you're making in your own space.
I think you should be selective with who you invite. But but yeah, and still like I'm, you know, I keep it
Real
under wraps.
namaste.
I have school allowed me to develop this like facade for situations like that. I call it my customer service birth, where I'm just like, and as a student too, like, you know, I was working in like really rural Washington and like a small town where like people did have like very different views than me, and like not everybody was super jazzed to have me at their birth, you know. Again, for like reasons of not being able to really like fly under the radar.
Sure.
And so like, yeah, there's situations where I'm like, you just listen to your husband, man. Like, he knows best. You know, and I'm like able to just like from the depths of my soul, I'm like, you don't want me here. And in my heart, like, I don't really want to be here, but like, we're doing this together.
We're doing it together, babe.
I'm not the midwife you wanted, but I'm the one that you got.
Right? Oh my God. Yeah. Yeah, like it is, of course, you know, the person giving birth is under tremendous stress, but this also seems like an incredibly stressful job for you too. And like managing personalities, also managing life entering this world, and that it's a lot. I mean, I'm glad that you have your routines and your veggie nuggets and things you also do to take care of yourself, because you are, it sounds like, the pillar for these families going through this process, and that's a lot of pressure to put on you. Yeah. But it sounds like you love doing what you do.
Yeah, I do. I really do. And I'm kind of grateful for those situations where I haven't like seen eye to eye with some clients, or like, you know, there's been like awkward moments where like as a student, like people were like, oh, well, I don't really want them at my birth. And then, you know, then the practice had to be like, okay, well, they are the only one that can assist at this birth. So you kind of like have
slim
to,
pickings.
You know? And so like we're both there and like we both know. But like at the end of the day, like my job is to like give people good care no matter what. And so like I do feel like really strongly about like, okay, like, you know, even if there's this mismatch or whatever, like I'm still gonna give you really good care. And like
it's just the human aspect of it.
And I do think you know, it takes practice. Maybe I don't always get it perfect, but it is a very emotionally, physically intensive, and it is a lot of pressure, but I love it so much, and getting to like create this space for families and getting to see people come out of this experience empowered is really like, you know, my why and what makes it worth it for me.
Right.
Yeah.
Oh, I can't even imagine. Okay, so what advice do you have for any anxious mothers and fathers to be who are maybe entering this process, just got the positive pregnancy test, and who maybe are interested in midwifery, but are just feeling overwhelmed with the whole process? What would that advice be to them?
Well, come take my workshop next week. But no, like I think it's really hard, and I think most people, we just don't get information about birth. We don't get information about pregnancy that's like accurate. We're basing most of our expectations off of media or like maybe like hearing stories from people. But I would say for the most part, people just don't really understand what they're getting into when they're going into hospital care, and then like what they experience is just so like different from what, you know, they are wanting from that, which is like this huge life transition is happening, this huge social transformation is happening for them, and they're just like awestruck because it is like incredible. Like they're starting a family, like they're going on this journey, and then to like be met with like the sterile insensitivity and like just like rote monotony of like, okay, well, like, you know, just trying to get people in and out. It is really like shocking for people, but it's hard to know what you don't know until you go through it. So I would just say, like, if people are already experiencing that and they like, I would hope that they trust that intuition, you know, because I think a lot of people come out of these traumatic births, traumatic hospital births, where like they're treated, you know, without respect and dignity, and like are just kind of bulldozed over, and healthcare just kind of happens to them, like can come out of that and blame themselves and just be like, well, my bad, like I shouldn't have been expecting to be treated well,
just
you
crazy.
know, like I just should have complied immediately with what they said, and you know, like, and then I think there's other people that come out of it and they're like, no, like that was wrong, and like something about this doesn't feel right to me, and those people I think look into their options and find midwifery care, and and I would hope that people, like more people come out of that experience and like have that, are able to trust that intuition.
Sure. Sounds like there's a lot of simultaneous learning and unlearning happening with this process, right? I've had to unlearn some things too. I mean, it's there's so much that goes into it, but I also it sounds like we complicate things and also are taking away kind of the most connected emotional parts of birth that make the process all the better. Like trying to instill, and it sounds like in your practice you instill those more I don't even know the word, like just more human aspects of this process and taking it out of this hyper sterile. And again, there's a time and a place, and God bless, but also options, we have them.
Yeah. And education is like really powerful in that case. Like I think regardless where you give birth, like you have to do some kind of independent childbirth education, and not the free childbirth education that they offer at the hospital, which is basically like, here's how to be a good patient for us, you know? Like something
some independent.
Like actually someone who doesn't have stakes in the games, because like I, you know, when I tell people about my job or whatever, like sometimes it just goes in one ear out the other. It's like, well, you're a midwife, so obviously like you would think about it this way. But I do think it means a lot to come from like someone, like a third party, like a childbirth educator who's like, no, like actually like this is legit, you know, or like who understands the options, and someone else who sees it, you know, objectively, because like the other option is to just go into this with like a whim and a prayer, you know, and it's a huge thing that can affect your health, your family's health, your baby's health, like forever, you know? So like preparing yourself for that experience, like, you know, not just Googling, but like, getting, you know, taking some classes, getting that childbirth education, and then like, fully understanding your options. And then again, like just deciding like, what do you feel comfortable with? Where do you feel most comfortable? And like, everybody's going to have opinions, but like, what
resonates with you?
Chiming out, Mima, like, what do you think? What do you feel? And what feels right for you? Just understanding those options fully before you kind of get into the game,
into the process. Okay. Yeah. Oh, well, thank you so much. I end each episode with the same question, and it is, what do you wish more people understood about you? I know this is an industry that is profoundly misunderstood, but specifically you as Ray,
as an individual,
where do you feel somewhere in your life where you could use a little bit more understanding or a little bit more grace?
I think for like, you know, a lot of queer and trans people right now, like especially like everything that's just like constantly bombarding us in the news and our rights being under attack and everything, like I don't know. I'm a human being. I'm just a person living my life. That's all.
Totally.
You know, just like everybody else in that respect. Probably a little bit more fun. Probably a little bit more interesting. But,
yeah. Did you ever think about that?
Yeah.
Huh?
But yeah, I'm just out here living my life, trying to chase my joy.
I love it.
Yeah.
I love it so much. Well, thank you so much. This has been immensely informational and interesting, and I'm probably going to be marinating on all of this for a good 48 hours.
Aww.
Not that there's anything growing inside of me, but just in case. I want to include your website if anyone is interested in hiring you or getting to know more about what you do. And I just want to see where life takes you, because it sounds like you're doing some pretty cool shit.
Oh, thank you so much. Yeah. And you know, just a plug to anybody that is interested in getting into midwifery or like interested in this world. I was so overwhelmed like when I first found out that it was an option, but I'm always happy to talk to people too that are interested. So, you know, even if you're not trying to get my services, but like you want to just like, you know, you need a sounding board to be like, what am I about to do?
Right.
You know, like just let me know. And
Team,
I'm always happy to
you got
chat.
a resource.
Yeah.
I love it. Well, thank you so much.